Hello, my name is Dr. James McNabb. I'm a family physician in private practice in Mooresville, North Carolina. And I'm here today to talk to you about how to do knee injections. Today we have Donna. Donna is a 51-year-old lady who presents with a 5 to 6 week history of right knee pain. There was no injury to the knee, correct? It just gradually started up, and now she's complaining of diffuse knee pain, and that's worse with walking on it, right? So it's worse with walking, worse when you overuse it, right? Anything else that makes it worse?
Just sitting for
Sitting for a long period of time.
Yes, sitting.
Okay. And she's tried. Initially, there was an oral prednisone taper that we used. Then she has been taking Celebrex, ibuprofen, rest, ice, and heat. Right. All those things just really haven't given you the relief you're looking for yet. About 1 week ago, she was working out with her Wii Fit and doing the walking with that, and it's been killing her ever since that time, right? So we've gone over the probable diagnoses after doing a physical examination. The exam pretty much just shows joint line tenderness, no real swelling, no instability, everything seems intact, but she's got tenderness along the joint line on both sides and behind her knee with positive McMurray's test. So I think what we're dealing right now with just kind of a generalized inflammation or arthritis inside the knee itself. So we spoke about the different treatment options that she has. We can use oral anti-inflammatories or even oral steroids, but they haven't been effective so far. We could enforce rest, but that's tough with you because you work as a hairdresser, and so you're on your feet all day. You can't really work from a chair, can you? No. So really, I think right now the only real viable option that we have is to use a corticosteroid injection. So what we'd like to do is to move you into a position in just a moment where we'd be laying down. We're going to go ahead and provide some topical anesthesia to the skin. We're going to put a needle in, see if we can have it, see if we can draw off any fluid. If we can, that's great. If we can't, that's okay. We'll put steroid in, and hopefully within a short period of time you'll be feeling better.
Okay.
Okay? Do you have any questions right now?
I just don't want any pain.
Okay.
Worse pain.
Okay. Well, and we're going to show you some tricks that we're going to show the audience some tricks today that they can use to help hopefully prevent any pain on your part. So we'll see if this works. Okay.
Right.
All right. Okay, now Donna is now laid down. I've gone ahead and put a couple of Chuck's pads underneath the knee in order to bolster it here so that it puts it in a more comfortable position. The next thing what we need to do is we need to decide how we're going to enter the knee. There's several different ways that I can enter the knee. What I'm going to do with this is my most common approach, which is the lateral suprapatellar approach. So we know that the joint capsule extends above the top of the patella, probably about 4 or 5 centimeters. And so what we want to do is to access just above the top of the patella, maybe a centimeter or two above the top of the patella. And this offers several advantages. The most important advantage is that it allows us to access the knee joint without damaging articular cartilage. So instead of going infrapatellar or even angling up underneath the kneecap and contacting the posterior aspect of the patella, we can actually come right in here, get into the joint capsule without damaging any intra-articular cartilage. So that's a huge advantage, and it's really a wide open area, so it's very easy to perform. So what I'm going to do is find my landmarks. So the first landmark is to draw a vertical line with her in the supine position. Draw a vertical line about a finger breadth or so above the top of the patella. So we're going to do that. And it's about 2 centimeters or so above the top of the patella, and just draw a vertical line straight down. Now we're going to find the undersurface of the patella, and here it is. You can see her patella as I push on it will bulge out laterally. There's the undersurface of the patella, about a centimeter below that. I'm going to draw a horizontal line. and where these two lines intersect is the point of injection. So with the retracted tip of the ballpoint pen, I'm making an indentation and we'll release it. At this point, we need to clean the injection site, and so just simple alcohol right here, and that removes the ink lines and preps the skin. Now we're going to add a betadine swab, followed by a second betadine swab in order to sterilize the site. Next comes the topical anesthetic, and for this demonstration we're going to use Bauer's pain ease. Up to this point in time I've been using ethyl chloride, but I really like pain ease. Pain ease I think gives us a little wider spray area there. It provides a little denser anesthesia for that, and I'm now able to pass directly 18 gauge needles, where with ethyl chloride I was limited to 25 gauge needles. So we're going to use this. There's kind of a specific way you need to use it because it comes out as a mist. And what I'm going to do is hold it about 4 inches from the site of the injection and perpendicular to the skin, and inject directly on the skin. So here we go. I'm going to spray right here. Now, Donna, this is going to feel cold, okay?
Yes.
All right. I'm just going to give you a little burst first. Is that cold?
Yes.
Very cold?
Pretty cold.
Okay. So let's give you a little bit more, and we're going to wait till it turns white. There it is. So is it almost a burning sensation?
Yes.
Because it's so cold. Okay.
Yes.
Now I put the needle in. Did you feel that?
No.
No. How about that?
Yes.
Now you feel it. Okay.
Yes.
Well, I'm well in the knee, and actually right there, right over the femur. If she's got fluid in the knee capsule, we'll find it now. And did not. The only thing you felt was when I touched the bone.
Right.
With it. That's called the periosteum, which is a painful structure. So I know now that I'm in the knee joint. Are you having any pain at all?
No.
Now what I give is a mixture. I just took a 25 gauge needle off of this. I've taken it off of it. Now it's a mixture of 8 mLs of 1% lidocaine without epinephrine and 1 ml of Kenalog, which is triamcinolone. Put about, so that gives me 9 mLs in a 10 ml syringe. Put a couple cc's of air so I can mix it together. Mixing it together here. Push the air out, and now I'm going to reattach it to the 18 gauge needle. Here I've done that, and inject. Going in extremely easily, and at this point we're ready to remove the whole thing, and you've just had your knee injection done. Did that hurt?
No.
The thought of it wasn't good.
Yes.
Huh?
That's the worst part.
I can see you're having some trouble with that. So here we are with that, but it's all done. It's all gone, and you should be feeling better here in just a little bit.
Okay.
Okay? So we just finished the procedure. Overall, how would you rate the procedure as far as what really happened versus your expectation?
It was painless.
It was painless.
Yes.
Okay.
I think the thought of it was worse than any of it.
It was.
Yes.
We didn't talk about this before, right?
Right.
Okay. Okay. So how does your knee feel right now? This is a couple minutes after the procedure. How does it feel right now?
I don't have the aching that I was having.
The aching is gone. Okay. So do you have any pain right now?
No.
No pain.
Not at this moment.
Okay. Now how about, you don't have any pain here, how about on this side of the knee or behind the knee? Nothing there? Popping? Anything like that?
I think there's a little popping in my knee, but I don't think it's,
Okay.
I mean, it's not as painful. The overall knee feels better.
Good, good. So now let's do this. Will be the test. So let's go ahead and stand up and kind of stand right down here on the floor. Okay, now you were limping quite a bit when you came into the room, so maybe just walk over to the trash can and back over this way, and tell me how your knee feels at this point.
Better.
You're not even limping at all.
No.
Very good. Thank you so much. Okay.